Tonight, KOIN gets results for a local man in a dispute with a Washington hospital over a huge surgery bill.
Now, we first shared Harry Henery's story yesterday at 5. He's on unemployment, and he didn't have health insurance when he had to have emergency surgery.
Amy Frazier joins us now with more on this. And Amy, you actually spoke to Harry again today?
I did, Kelly. He tells me he is so relieved by what's happened today that he's still trying to soak it all in. I contacted a hospital manager yesterday about Harry's situation. Today, he says the hospital worked out a plan for payments he can afford.
I feel relief. I mean, I don't have the weight of the world on my shoulders.
Harry Henery tells me Peace Health Southwest Medical Center reduced his bill, took it out of collections, and lowered his minimum monthly payment. Was this experience different for you than the last two times you called them?
Absolutely, absolutely. The last two times I felt like I was getting nowhere.
Harry reached out to us for help, saying he was laid off from his job in December, living on unemployment and unable to make $500 a month payments required, he says, by the hospital for the emergency surgery he had in February. As of today, he says his new payment is $100 a month.
They decided to reevaluate my situation, and then they reassured me that the news had nothing to do with it. And I'm thinking, yeah, right. You know, because I know without the news story, it wouldn't have happened.
The hospital manager who helped Harry agreed to speak with me by phone. In general, she says patients who have billing concerns can speak with a hospital financial counselor and must provide documentation of their situation. And if they're still not satisfied with the results they're getting, I mean, they shouldn't have to call the news. So what further steps could they take?
They can ask to have someone follow up, a supervisor or a manager follow up with them.
Harry says he's just happy he doesn't have to file for bankruptcy.
I would just like to say thank you to KOIN 6 News. You know, I appreciate everything you've done for me. I mean, if it wasn't for you, I feel I would be in the same situation I was before I contacted you.
Now, I also asked the hospital manager if she feels that mistakes were made in this case, either by the hospital or maybe by the patient. And she said, again, she couldn't talk specifics on this specific case. But again, she stresses that if you need help, they want to help you, you know, speak up, talk to them. But Harry says he feels like he did provide them with all the documentation they would need. So again, I think everybody looking forward to moving forward from this point.
Well, we got results. That's what's important.
That's right.
Thanks a lot, Amy.
Thanks, Amy. Much more news ahead. Next.